Emergency Management Director. Martin County Emergency Management is actively engaged in providing assistance and support to our community during this rapidly evolving event. We appreciate the efforts of all of our county residents to do what they can to protect individuals at increased risk, the healthcare workforce, critical infrastructure workers, and our residents and visitors. We continue to work closely with our nonprofit, local, state, and federal partners to develop plans to take care of those who may be impacted by this virus. It is important to remember that this is a public health emergency with the potential for cascading impacts for all of our public. We need to work together to demonstrate compassion, choose knowledge over fear, help protect the vulnerable, and lead with empathy. I'd like to turn it over to Commissioner Jenkins.
Hi, my name is Harold Jenkins, Chair Board for the Martin County Board of County Commissioners. I'm also accompanied by Commissioner Ed Campy and Commissioner Doug Smith. Martin County is currently in the process of issuing a local state of emergency because this is a necessary step for FEMA reimbursement. In the interest of keeping the public informed about what we are doing at the local level in response to the coronavirus, we are having a special board meeting on Wednesday, March 18th at 10 a.m. at the Martin County Administrative Center. We're inviting our local partners to attend, and staff will brief the board on the current efforts and status related to the COVID-19. This meeting will be aired on MCTV Channel 20 for Comcast subscribers, UVerse Channel 99. You can also watch it on our website www.martin.fl.us. And now I'd like to turn things over to Taryn Krista. Thank you.
Hi, I'm Taryn Krista, the County Administrator here for Martin County. So I'd like to begin by saying that we are working very closely with our first responders, your sheriff and fire rescue and emergency management. They have established the necessary protocols and are prepared to save lives and help in the response when needed. We encourage each and every one of you to take personal protective actions to keep you and your family safe. Ensure the readiness of your disaster supply kit, practice social distancing, and avoid close contact with the people who are sick. Discuss how your family may take care of sick family members while trying not to get infected. At the BOCC, we are taking proactive steps to maintain a safe workforce, and our focus continues to be on the safety of our employees, our residents, and visitors that we serve. We're increasing full-service cleaning in our county-owned facilities to disinfect those high-touch surfaces with a focus on also high-traffic areas. We also want to ensure the community and the continuity of business operations and delivery of our essential services, so we have updated our policies and have emergency plans. And I'd like to share some additional information that we have received from some of the other constitutional officers. As you probably have already heard, Martin County School District operated schools are closed through Friday, March 27th. For the latest school information and updates, please visit martinschools.org. The Martin County Clerk of the Courts has announced that all jury trials are canceled through March 27th. In addition, the clerk would like to remind residents that their court fees and traffic tickets can be paid online, and that you can use e-Notify. It's a great way to get reminders about court hearings. More information is available at martinclerk.com. The Tax Collector's Office would also like to remind residents that many services, including payments for property and business taxes, can be handled online or by phone. Visit martintaxcollector.com for details. And our Supervisor of Elections Office would like to share that although there is ongoing construction, Pratt & Whitney Road will be open on March 17th to accommodate the polling location at Christ Fellowship Church. And now I'd like to introduce to you Carol Ann Vitani, your Health Department.
Good afternoon. My name is Carol Ann Vitani. I am the Health Officer of the Florida Department of Health in Martin County. First, let me say that there are no cases of COVID-19 in Martin County. This is a dynamic and rapidly evolving situation, but here is what you need to know. The Department of Health is working closely with the CDC to monitor the virus, and we have been actively working with our local partners for several weeks to ensure that the most up-to-date CDC guidance is quickly disseminated throughout the community. We are receiving many questions about testing and symptoms. Let's discuss symptoms. Symptoms include fever, cough, and difficulty breathing. Regarding testing, from the Department of Health's perspective, we understand the concerns of people who want to be tested regardless of symptoms or travel. At this time, we are following the current CDC and DOH protocols. We ask our physicians to assess their patients first to rule out any other illness. You should call your doctor. If you have been in close contact with a confirmed case of COVID-19 and have symptoms, if you have traveled to a level 3 affected area listed on the CDC website within 14 days and are experiencing symptoms, they are, as of now, all of Europe, China, Iran, and South Korea. Regarding cruises and level 2 areas, such as Japan, travelers should monitor their health and limit interaction for 14 days after their return. If you become symptomatic, self-isolate and contact your healthcare provider. Everyone has a role to play in this preventing the spread of this virus. The best way to protect yourself is to practice good hygiene, which includes frequent hand washing, cover your mouth when you sneeze or cough, avoid touching your face, staying at home when you're sick, and good surface cleaning. And lastly, a DOH call center is in place 24/7 to answer any of your questions. That number is 1-866-779-6121, and the dedicated website is www.flhealth.gov. And now I'd like to turn it over to Dr. Petrie from the Cleveland Clinic.
Thank you. My name is Dr. Fernando Petrie. I'm the Chief Medical Officer at Cleveland Clinic Martin Health. Safety of our patients, our visitors, our caregivers, and our community is our top priority. As a reminder, as Carol mentioned, there are no confirmed cases of COVID-19 in Martin and St. Lucie County at this time. However, we are continuing to plan and prepare and are seeking to minimize contact with facilities between individuals who may have had the virus and our visitors, patients, and caregivers. Cleveland Clinic Martin Health is now performing outpatient drive-through testing at Martin North Hospital for influenza and COVID-19 by appointment only. Testing will be performed only for those individuals who meet the Florida Department of Health and CDC criteria for COVID testing. If individuals do not meet that criteria, testing will not be performed. To receive an appointment, individuals who believe that they may have symptoms of COVID-19, they must first call our nurse triage hotline at 772-419-3360. The hotline will be open from 8 a.m. to 5 p.m. Nurses will then discuss the individual's symptoms, their travel history, and potential contacts with others that may have been diagnosed with COVID-19. If they meet criteria, they will be given an appointment time to go through our drive-through testing location. Test results are estimated to return in 3 to 5 days. Individuals who receive these tests will be asked to self-quarantine until those results are received. The covered areas outside the outpatient entrance at Martin North Hospital has been designated as the drive-through testing facility. Testing will take place from 8 a.m. to 5 p.m., 7 days a week, and again, this testing is by appointment only. We anticipate that we will have a drive-through testing location at Martin South Hospital and Cleveland Clinic Tradition Hospital by the end of the week. This is part of the work that is taking place across the Cleveland Clinic Florida region. Similar sites will be available at some point next week. Other processes are also available to address the people's health concerns that can minimize exposures to others. This includes the Cleveland Clinic virtual visit platform called Express Care Online. It is available on an Apple App Store or Google Play, and it connects you with a primary care provider. We encourage people not to come to the emergency room for mild symptoms or to get tested. This is an unpredictable virus, and the current situation is evolving. We will continue to monitor the situation and will make changes as necessary, but we encourage those people that have severe symptoms such as cough, shortness of breath, fever, and worsening signs and symptoms to come immediately to the emergency department for assistance. And now, I turn over to Mr. Chris Saska, our Chief Operations Officer, for any operational issues.
We will continue to monitor our supplies on a daily basis. We have been planning for this event over the past 2 months, conducting tabletop exercises, including managing in staffing shortage. So we continue to be prepared. We are working with our non-essential patient-facing caregivers to work from home, again, to protect our caregivers and those that have to be at the hospital. We have put in adjusted visitation hours. We will continue to monitor our visitation hours as we continue to progress through this planning.
So we want you all to be able to stay connected. The Florida Department of Health call center is available 24 hours a day, 7 days a week at 866-779-6121 or by email at covid-19@flhealth.gov. There are many resources available on the website at www.floridahealth.gov/covid-19. For more information, you can also visit the CDC's website at www.cdc.gov/coronavirus. Martin Health's website is martinhealth.org, and the nurse triage phone number is again 772-419-3360. Martin County continues to update our website with information, and you can visit us at www.martin.fl.us/coronavirus. We will begin sending information through our notification system. We have Alert Martin, and if you have not signed up yet, you just text the word Alert Martin to 888-777. And with that, we can conclude and we can take questions.
I have a question for Dr. Petrie.
Absolutely.
You're having the drive-through clinics. This is the first one that I know of. Their specific location has been announced. To keep people from rushing and everybody, you have appointment only, but from how wide a catch area can people try to schedule appointments specifically for yours? Does it go as far south as Jupiter, Palm Beach, Boca? What are the geographical parameters of what you're looking at?
At this moment, we're trying to care for our community, so our site is going to be open for Martin County residents and for St. Lucie County residents. We are opening up 2 additional sites at the South Hospital and also the Tradition Campus, hopefully by this week coming up. But once those open up, we will alert the public so that we can have those people drive to those facilities.
Could you give us a ballpark on how many kits you have and if you believe the supply is adequate, knowing that there are certainly a lot of people who would like to be tested?
Right.
Be seen as tested?
So we don't have kits at this time. It's not kits that we're utilizing. We're utilizing swabs, which are part of the commercial testing reference lab supplies that we have on hand. That supply line is being monitored closely, and we are determining, based on the demand, the need for resupplies. So Mr. Saska is involved in that, and we're doing that on a constant basis because we don't know what the demand will be, but we have the ability to look at regional and also local resources to meet that demand.
So if somebody goes in for a test, how long before they know the results of those tests? Is that method you're describing?
That is coming back right now at about a 3 to 5 day basis.
Can you repeat the question? They can't hear him.
sorry.
Oh, I'm sorry.
I s-
Okay,
No, for him to repeat the
I'll,
question into
I'll
the
repeat,
microphone.
right.
I got you. So anyway, I think we answered that though, right? If that's, I mean,
Sure.
yeah, I think we'll-
Okay. So the question was to how we're meeting the supply and demand, and as I mentioned, and how long the test is taking. It is currently 3 to 5 days. And so we'll continue to monitor our supplies closely so that we can meet the surge demand at this time. Okay.
I have a question for anybody that can answer a question regarding the school district, if I can. Is there anybody here? Let me ask a question, maybe somebody can take it, if you can't, let me know. Because there's some confusion over spring break and the week or time that school has, is out. Tell me the plans for feeding the people that are on the programs where they get, you know, breakfast and lunch. Is there anybody there that can answer that and how it works?
So the question was, how are the school district feeding those kids that might need food during spring break and during the closure? They're working through that plan, and I believe they'll release that information on their website and through their social media and normal distribution channels.
Okay, so, but nobody in this room has an exact answer for what we're doing.
Correct.
I had an opportunity to speak to Lori. My name is Ed Campy. I'm one of the Martin County Commissioners. I had an opportunity to speak with Superintendent Lori Gaylord yesterday, and she said that since the spring break was starting, the normal procedures that children that need food during a closing, that system was in place for the week coming up. Excuse me, for the week coming up. I know that our not-for-profits and our food banks in the area have been working overtime, just as the supermarkets have seen a run on supplies, so have our not-for-profit food pantries. So they are collaborating with all of our not-for-profits countywide so that we can create a opportunity for families that need that food even after the spring break is over, because as we've all heard, it will extend for at least an additional week. So with that in mind, there will be the school district, they normally do a backpack program for kids. So they've done that already for the kids that would have been on spring break anyway. And we're working collaboratively with our not-for-profits so that not only can we distribute food, we can distribute food safely for the folks that are volunteering or work at those not-for-profit food pantries and for the visitors that are coming to get the food. The other issue is folks that don't have the ability or the transportation means to pick up that food. We're working with the Kane Center and Meals on Wheels to make sure that the people that don't come out have the ability to address who those folks are and make sure that they're taken care of as well.
One other follow-up on that, since you have been in contact with the superintendent. Do you know of any plans for the week where school is actually going to be canceled involving nonprofits to take care of kids whose parents are having a hard time finding childcare arrangements now that their kids, you know, are going to be out of school and, you know, caught by surprise like everybody else is in this situation?
The superintendent did tell us, inform us during a informational call yesterday that although the schools will be closed an additional week to students, there is a possibility that some personnel will be responsible for still coming in. I guess they're taking direction. As a matter of fact, I know they're taking direction from the Department of Education and the governor's office on what that'll exactly mean. That question that you mentioned, what would happen to employees of or parents of students that have to continue to work, where will their kids go in terms of daycare? That will be an issue for every parent, whether their students are home, if they have to work, what do they do with the kids? And even with their own employees to keep employees safe. I know that based on what the president had mentioned yesterday, there will be funding opportunities and grant programs in place to assist some people that might need to take that time off but can't afford to not get paid during that time.
And you don't have a lot of time to implement these plans. Is that, how much of a challenge is that?
The question was, we don't have a lot of time to implement these plans, and what type of challenge is that? I think everyone is aware of the fact that this changes every single day. You know, tomorrow we might be speaking, hopefully, of a better scenario, but under the circumstances, I think we've trained the hospital, our emergency management folks and governments in general have trained for these kind of situations. Now, this one is completely different because it's not a regional issue, it's a nationwide issue. And so I think some of it will have to rely on us making it up as we go along, but when you have the right people that know their jobs and what needs to be done, I think we're going to be in great hands. Thank you.